I'm going to try to answer some commonly asked questions. The first one is regarding caffeine. So you'll hear the message from us a lot that we don't want you drinking soda. There's a couple of reasons for that. One reason is that there is data, now it's observational data, that individuals who drink soda, even diet soda, weigh more than those who don't. Now we can dive into the nuances of that, but that's one of the reasons why we recommend it. Another reason is if it's not a diet soda and you're drinking a lot of it, that sugar is not going to help in your weight loss. In fact, it's going to impede it. And then a third, maybe more theoretical reason is that gas distends the stomach, stretches things out, and we're trying to give you a small stomach, a small pouch, and we don't want to overeat or use things that are going to over distend that too much. And so those are all reasons why we recommend not drinking soda. So then on a separate question is, well, what about caffeine? What if I get my caffeine in a Crystal Light or something like that? Most of the time we recommend not using caffeine, especially early on. So caffeine is a gastric irritant or a stomach irritant. And if you're using caffeine, it can affect the lining of the stomach. And early on, when the stomach is healing, we definitely don't want you consuming caffeine. Now, later on, that's less of a concern from a gastric irritation standpoint because everything's healed. But for some individuals, caffeine can actually cause them to eat more because they stay awake longer, they feel more energetic, they're doing more, and so they end up eating more. And if you're someone who responds to caffeine like that, then I would say no, caffeine is not a good option for you. For other individuals, it actually helps them suppress appetite a little bit. And so if you're in that category, caffeine may be beneficial for you. Some individuals will use caffeinated drinks to help them not eat as much. So, rather than eating a meal, they'll have a caffeinated drink, and that helps them get through. And so if you use it as that type of a tool, then caffeine could potentially be beneficial. One other comment on caffeine is a diuretic, which means it makes you pee. It forces your body to pee. So especially early on, if you're really struggling to stay hydrated, that's another reason why caffeine would not be beneficial, is because it will make you more dehydrated. So those are reasons why we often would recommend not using caffeine, but of course you can see there are some nuances in there. Another question that comes up is the use of alcohol. So alcohol, we typically recommend not using alcohol. There are a couple reasons for that. One is all of these operations change your absorption. So you are going to be affected by a much smaller volume of alcohol than you were before. So that's one reason. A second reason is that it's basically empty calories. And so when we're trying to be really vigilant about the calories you're taking in, there's no nutrients that come with it. And so it's a way to get in a bunch of empty calories. So that's another reason we typically don't recommend alcohol. And then the third reason would be, interestingly, if you look at populations of patients who've had weight loss surgery, there's a higher risk of substance abuse, of alcohol addiction after weight loss surgery. So we'd hate to put somebody in a situation where that became a problem for them. Now, if you had an occasional drink once in a while, is that going to destroy everything? No, of course not. But those are the reasons why we typically don't recommend drinking alcohol. We recommend not smoking ever after surgery. Now, there's a few reasons for that. Number one, health, right? I mean, you've just gone through a big process to improve your health. Smoking bounces back and forth with obesity as the number one cause of preventable death in the United States. And so just from a health standpoint, we recommend don't smoke. A second reason is because it affects wound healing. So especially around the time of surgery, you're not going to heal those connections we make on the inside or the incisions, higher risk of wound infections, so we will not operate on patients who are actively smoking. And then the third reason is for what it can do to the internal anatomy, especially with a gastric bypass anatomy. The connection between the stomach and the small intestine is prone to developing ulcers, particularly in patients who smoke or who use NSAIDs like ibuprofen and naproxen. So even 5 years out from surgery, if you start smoking, you can get one of those ulcers, which can cause a hole, which can cause bleeding, it can cause stricturing or narrowing. And so we just recommend no smoking for the rest of your life. Sometimes in our program, and I particularly will tell patients that during your weight loss phase, I don't want you to eat fruit. Here's the rationale behind that. When you have a small gastric pouch and you're not eating very much, we want to really focus on important nutrients. Number one, we're always pushing protein because your body can't produce protein. And so it has to take it just from what you eat. You need to focus on protein, and then if we're adding something else in, I'm going to recommend vegetables be that thing. A couple of reasons for that. There are a lot of micronutrients that come packaged in vegetables. It can help you feel better. It can give you more energy. Technically, vegetables are a carbohydrate, and they're a very complex carbohydrate. They have a lot of fiber packed with them. So they're going to have a very minimal insulin response when you eat them. Now, if you compare that to a fruit is also a very good food choice. It just has a higher sugar content, and it is going to push your insulin higher than a vegetable will. When you do eat fruit, I recommend that you eat it as a whole fruit. That fiber will help blunt that insulin response. You should not juice it, because then all you're basically getting is the sugar in the juice. And so when you eat fruit, it should be as the whole fruit. But if we compare it, if you're eating, that much in a meal, and that's fruit versus a vegetable, you're just going to get a higher insulin response, which is going to affect weight loss if you're doing it all the time. Now, one way that fruit can come in and help patients is it can be, that's my treat, that's my dessert. I need something sweet. Great, fruit fills that role very, very well. But that is why I and others will sometimes recommend not eating fruit during your weight loss phase. We're just trying to maximize the amount of weight you can lose during that honeymoon period. Now, are you going to fall off the rails if you eat some fruit? No, of course not. But that's the rationale behind why you will hear that recommendation sometimes. Sometimes you may hear from some of us some absolutes or some extreme statements like, you can never eat that again, or you can never drink that again. One of the reasons we may use some of that extreme language is trying to help individuals shift from a very different lifestyle to a more appropriate lifestyle long term. And let's take just one simple example, sugar. At some point in the process, somebody may have said, you can never eat sugar again. Well, the reality is you can be very successful and still have simple sugars. But what's important is how you manage that. If you are someone who 90+% of the time you're eating protein and veggies, and occasionally you'll have a little bit of sugar here or there, you're probably going to be just fine. If you're someone who has a sugar addiction and sugar is a big part of your life, then you may want to look at it as, I'm not going to do that again because of what that could lead me to. If it's going to start me, eating sugar every day and eating lots of sugar every day, then that could undo all of the work you've gone through. So sometimes when we use extreme language, we're just trying to be supportive of making that shift. Now, I will have patients occasionally say, I'm not perfect. We don't expect you to be. Nobody is. And, you're going to be out to eat or at a party or whatever, and there's going to be, something you really, really like, and you're going to have a bite or two of it. And honestly, most of the time in those situations, you're going to be absolutely fine. But recognize if we're using that extreme language, we're just trying to help you make those shifts, recognizing that nobody's going to be able to stick to that 100%. One of the things we hear sometimes is, my surgeon or the staff told me this, but when I look it up online, this is the opinion I get. Or I have a friend who had their surgery done somewhere else, and they were allowed to do this, but my surgeon says I can't do that. The basic issue is that there are a lot of opinions when it comes to what is the best way to be successful with surgical weight loss. Surgeons are going to have their opinions, staff are going to have their opinions, patients are going to have their opinions. So there's tons of opinions out there. We make recommendations based on the experience we have, based on how we've seen patients be successful, and we try to tailor those recommendations to the things that are going to help you be most successful. Now, could one of those recommendations be different than somebody else is doing? Sure, absolutely. And we would invite you to have that conversation with us, and we're happy to explain the rationale between why we made one recommendation or another. But it's important to understand there's a lot of opinions out there, some good, some not so good. We've been doing this a lot of years, and we will give you recommendations to help you be as successful as possible.